Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Here is what I bring to you from the world of medicine. New report highlights need for sustained investment in infection prevention and control programs. Nearly 5 years since COVID-19 was first reported, a new global report on infection prevention and control by the World Health Organization shows there has been slow progress in addressing critical gaps to prevent healthcare-associated infections. A large proportion of healthcare-associated infections can be prevented with improved infection prevention and control practices and basic water, sanitation and hygiene services, which are also a highly cost-effective best buy to reduce antimicrobial resistance in healthcare settings. This report, launched at a G7 side event hosted by Italy, provides a baseline assessment for policymakers, infection prevention and control professionals, healthcare workers and stakeholders to guide action. The report finds that though 71% of countries now have an active infection prevention and control program, just 6% met all of the WHO infection prevention and control minimum requirements in 2023 and 2024. This is well behind the target of more than 90% by 2030 set in the WHO Global Action Plan and Monitoring Framework on Infection Prevention and Control. The report also highlights that patients in low and middle income countries have up to 20 times higher risk of acquiring infections during healthcare delivery than in high-income countries. The COVID-19 pandemic, along with outbreaks of Ebola, Marburg and Mpox, are the most dramatic demonstrations of how pathogens can spread rapidly and be amplified in healthcare settings. These healthcare-associated infections are a daily threat in every hospital and clinic, not only during epidemics and pandemics, said WHO Director General Dr. Tedros Adhanom Ghebreyesus. Every country can and must do more to prevent infections in healthcare facilities and control them when they strike. Healthcare-associated infections prolong hospital stays and result in complications such as sepsis and in some cases disability or death. Addressing healthcare-associated infections through improved infection prevention and control is also critical to reduce the risk of antimicrobial resistance, as recent estimates indicate that 136 million antibiotic-resistant healthcare-associated infections occur each year. The report found that healthcare facilities face significant financial and resource challenges, including a lack of infection prevention and control professionals and budget, especially in low and middle income countries. Nearly a quarter of countries reported shortages in their supply of personal protective equipment in 2023. New data from WHO and the Organization for Economic Cooperation and Development estimates that up to 3.5 million patients could die each year from healthcare-associated infections without urgent action. Improving infection prevention and control measures at every level will help to reduce the number of deaths. The modeling estimated that IPC interventions at the point of care in healthcare facilities, coordinated by ministries of health or established networks, could avert up to 8,21,000 deaths per year by 2050. Such an intervention would also yield annual savings in healthcare expenditure as high as $112 billion and generate economic gains up to $124 billion. WHO is committed to supporting countries to ensure that by 2030, everyone accessing and providing healthcare is safe from healthcare-associated infections, said Dr. Bruce Aylward, WHO Assistant Director General, Universal Health Coverage Life Course. Fulfilling all infection prevention and control minimum requirements at the national and healthcare facility levels should be a priority for all countries to protect patients and healthcare workers and prevent unnecessary suffering. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.